Rising healthcare costs remain a top issue for 2020 voters, and Elizabeth Warren's Medicare for All plan will be front and center at Wednesday night's Democratic presidential debate in Atlanta. For a closer look at the future of healthcare, let's welcome Dr. Lloyd Minor, Dean of Stanford Medical School. It's great to have you in this morning. We want to play along and prevent things. That's the answer to all of this. Do you have a list of things we can do so that costs will go down when none of us ever get sick again? Isn't that really what we're talking about? Isn't that the best thing to try to do? Maybe technology can help us.
Absolutely. Well, one of the fundamental problems with cost and with outcomes in the U.S. healthcare delivery system today is that most, in fact, almost entirely, our focus is on after-the-fact care. It's on reactive care. If we're better able to predict and prevent disease, and we have the science and technology that should enable us to do that, if we're better able to predict and prevent disease, then we'll be better able to prevent the consequences of disease once it advances. And I'm really excited about the way technology can transform that. There's a lot we're doing at Stanford in that arena and a lot that's being done elsewhere as well.
Well, I know you spent a lot of time on the East Coast down at Johns Hopkins. Is it easier out in Palo Alto to develop these relationships with the right companies to forge ahead in the convergence between technology and healthcare?
Well, a couple of things. I think there's been a long tradition at Stanford of getting things into the world, and that involves commercialization very frequently. And the fact that the tech community is around us, and in so many ways Stanford has contributed to helping that community develop. It's more fluid to develop those relationships. We're working with Apple, we're working with various divisions of Alphabet, really to lead the revolution in digital health, both with consumer-facing devices and technologies, and also with machine learning, AI-enabled analytics. And that's the way we're going to really be able to get at this cost problem and predicting and preventing disease.
I know, Doctor, you don't want to weigh in specifically on Medicare for All, necessarily. We'll litigate this over the next 11 months and probably over the next 20 years. I don't know how long it'll take, because I can't imagine private insurance being easy to take away from most people, and most people are covered that way. So I don't know what eventually going to happen. Should that be our goal? And my question, the crux of this whole thing is, does getting rid of the profit incentive actually make it easier to control costs, since you don't have to worry about profits? You don't need to make money, so it should be cheaper to deliver care. Or does the lack of the profit incentive make it impossible to contain costs because there's no one watching the store, watching the piece? That's the ultimate question. Do you know the answer?
I don't know the full answer, but I do know that in a strictly fee-for-service world where we're being paid for increments of care, in many cases not linked to outcomes, that's a problem. Whether or not you consider it a for-profit system or not-for-profit system. So the more we can move to value-based reimbursements, the more we can move towards evaluating outcomes and then rewarding based upon improved outcomes, the better the health of Americans will be and the better our delivery system will be.
You know, Doctor, the entire time we were considering Obamacare and the Affordable Care Act, that seemed like what everybody was saying through that entire period of time. Here we are 10 years later. Have we gotten any better at that? Are there places where we're making progress on that front?
I think we have had fewer uninsured Americans, more insured Americans, and that, in principle, is a good thing.
I just mean in terms of paying for outcomes or paying for preventative care versus paying on this fee-for-service.
The number of bundled payment arrangements are increasing for things like joint replacement, certain forms of heart surgery. Could that pace be increased? Probably so. I think, though, that really the fundamental issue is twofold. One, predicting and preventing disease, and the other is getting information from all the data we have out there today. You know, we've moved from paper records to electronic records, but really what we've done is to substitute or to get rid of paper filing cabinets and substitute them with electronic filing cabinets. We still haven't gotten or leveraged the information that's embedded within all that data. And until we do, we're not going to be able to really deliver the type of informed improvement in healthcare delivery that we've seen in so many other sectors of the economy because they've been empowered by information. We're still really not in healthcare.
Doctor, I want to go back to your excitement about we getting better at predicting and preventing.
Right.
And link it to a conversation we had before you came on set here during the break about a flu shot. what are the behavioral scientists telling you about not whether you're going to be able to predict and prevent, but whether you're going to be able to change our behavior, the consumer's behavior? So what does it take to match the science, what you're excited about, to the fact that human behaviors tend to lag the science?
Absolutely.
What are they telling you?
Well, behavior is the hardest thing to change. That's one thing we all know. I do think technology has a role, and I think we're seeing the effects of technology. Wearables all too frequently sit on the shelf, but as it becomes easier for our health behaviors to be informed by information we get about our health, the more we're able to effectively change behavior. And let me mention a couple of examples. There are several companies that have focused on this, particularly in the area of diabetes control, where we have one variable that we know is very important, that's glucose level. So if you look at companies like Livongo, Omada Health, what they're doing is they're creating communities to help people change behavior regarding diet, regarding taking of medications, and to better control or eliminate type 2 diabetes. Technology can play an important role in helping behavior change, but that is, I think, the most complicated thing about really having an impact on the outcomes in healthcare.
I wear this all the time in here, this IFB. You're the preeminent expert on all things inner ear, are you not? You've won awards and everything.
He is.
Yes.
He is.
He's won awards for studying how the ear works with the balance system and hearing. Yes.
These things are not good for us, I don't think.
Do you have anything for Trump derangement syndrome? Do you know, is there a drug or a
different question? What about headphones? Do you keep headphones in your ears at all or not?
I occasionally use earbuds. I think the key is to keep the volume down. And now there are ways we can monitor the amount of noise exposure we're getting. And I think
you have no worries about the Bluetooth near the brain?
Well, that's a different subject.
Whether or not it's Wi-Fi or Bluetooth, I think we need a lot more studies and evidence to know whether or not it's going to be a problem.
Yeah.